Which in the following is the effect of the parasympathetic autonomic nervous system on the urinary tract? So remember, when we have our parasympathetic, which is your rest and digest nervous system, not to be confused with your sympathetic nervous system, which is your fight or flight response. Fight/flight. So we're focusing more on the rest and digest part, and we want to know which of the following is the effect of this rest and digest part. So if we're thinking of it in terms of the urinary system, we're thinking in terms of urination. So we're thinking either are we retaining urine, are we keeping urine in, or are we releasing it and excreting it out? And which one would be related to this rest and digest process? So when we think rest, digest, we're thinking the task, we're thinking resting, we're thinking the digestive process and all of those bodily functions. And the digestive process, also we would have our excretion. So we might have stool, bowel movements, or we might have urination, as opposed to the fight or flight, where this is really your only focus. You are focusing on survival and defense. So in that moment, if you were really fighting off a creature that was coming to attack you, that would be all of the energy that the body's putting into it. There would be no focus on the digesting or the resting or the urination. The focus is just on fighting off the adrenaline rush toward whatever the threat is. So adrenaline rush, not with the digestion, not with the excretion. So therefore, if we're looking at the effect of the parasympathetic autonomic nervous system on the urinary tract, we want to focus on this digestion and excretion. So in that case, we want to focus on actual urination. And because we actually are having urination, we would go with which of these has to do with actually excreting or urinating. So going through the choices here, we see option A says urine retention. And the urinary retention would mean that we're not actually excreting anything. It means that the body is retaining or keeping the urine inside. So that wouldn't be what we're looking for. So we could eliminate option A. Option B is micturition, which is another word for excretion/urination. So excretion and urination, which is in fact what we are looking for to answer this question. So we could go with option B. If we look at option C and D, these would both be incorrect because option C, the urethral sphincter contraction, is actually what helps to keep urine inside and would therefore relate more to the retention and not the excretion. So we can eliminate option C. And then option D is the detrusor muscle relaxation. And this would be incorrect because this is something that lines inside the walls of the bladder, and when it does relax, the bladder will hold more urine. So when it will contract, it's kind of a contraction to push out the urine to be excreted. So therefore, option D would be incorrect for what we're looking for as well. So micturition, excretion of urine, this would be our answer.